They rolled out the first vaccines, the Pfizer vaccine here in LA.
Der Impfstart in Deutschland verlief eher etwas holprig. Da wurde wohl zu wenig Impfstoff bestellt.
The Indian regulator has given emergency approval to 2 different vaccine candidates.
We are informed that the government is trying to procure vaccines from the COVAX program.
The first group of people that were able to get the vaccine were the frontline healthcare workers who work directly with COVID patients, so the ER and ICU providers. And we, on labor and delivery, we sort of argued, well, we should be included in that tier because we're also seeing a lot of a lot of our patients, many of our pregnant women are COVID positive. Less providers than they anticipated actually ended up wanting to get the vaccine. And so every day they had a little bit left over. So at that point, they basically put the word out and said anybody in the hospital who wants the vaccine, any providers in the hospital can come and get it. And that's sort of how I ended up getting vaccinated.
Weil ich durch mein Engagement in den Impfzentren dann in die höchste Kategorie eingeordnet werde. Also da bin ich dann beim Personal dabei mit der höchsten Risikostufe. Und ich muss sagen, ich freue mich auch drauf, dass es dann soweit ist, weil ich auch nicht nur die Arbeit in den Impfzentren, sondern auch meine Arbeit als Hausärztin nicht ganz risikofrei sehe. Also wir sehen ja so viele Menschen, die zum Teil gar nicht wissen, dass sie unter einer Corona-Infektion leiden.
Some people feel like, oh, we're the first ones, I don't want to be the guinea pig. So they're just kind of waiting and seeing if there's side effects. And I have faith that when they see after a few weeks that we're still okay, that we don't have any major side effects, that they'll also take the vaccine.
Ich versuche da immer wieder aufzuklären und auch den Menschen die Ängste zu nehmen, dass die Impfung ein großer Segen ist für uns, dass wir endlich mal aus dieser Pandemie zumindest ein Stück weit rausrücken können.
So in the first phase of vaccination, the government is planning a very ambitious rollout in more than in about 300 million people. Initially, it will be for healthcare workers. We have concerns in respect of both of the approvals. Regarding the local vaccine, Bharat Biotech's Covaxin, it's called. The main concern is that the vaccine has been approved without any efficacy data. And this is because the vaccine is running a phase 3, the company is running a phase 3 trial, which is still ongoing. We're really not sure how they would do it, whether it would be available for public rollout because of this restriction that says that it is in clinical trial mode, and how people would exactly be consented.
As a country which has been having a deplorable state of healthcare system facilities, so we are also worried about the storage infrastructure for that vaccine.
I think that India in general has a very strong advantage because even at the moment, there are more than a dozen companies involved in developing different vaccine candidates across different platform technologies. And I think that we're quite optimistic that there will be more vaccine candidates getting approval in the coming months. And that could also be important not just for access and affordability in India, but also in terms of serving global needs.